All right. So tonight, I am grateful because we have the whiz that is going to help lead this call tonight, which is Carol. And like I mentioned on the last call, if you watched that, she really was one of the pivotal people to help get this program implemented. And so um, I think her and I tag teaming about the brand partner side and what does this look like to share with other people? Like, what do I really need to know to tell other people, right, about this program and all of that? I think this is going to be the call for you because I know if you're like me, I have felt very apprehensive learning or even talking about it because it doesn't apply to me. I'm not going to participate in this plan because it doesn't fit the needs for our family. But that is really the wrong attitude. And I really need to get smart on what I need to do because there's so many people that do need this, right? And so that is the intent tonight, is just to kind of give you ideas, give you the next steps. What does this look like in terms of possibility for your business as far as not only helping people, but what does it look like to add that PV? Because remember, you're not just getting, you will get PV, a portion of that monthly cost that somebody has. You get a portion of that in your monthly PV for your OGV. However, you also will have OGV from people, buying Young Living products because they get that reimbursed. So, and I know Carol will probably cover that in a better overall view. So I'm going to hand it over to Carol and then let her share. And then, yeah, we'll just kind of tag team. And if you have questions, go ahead and put them in the chat. And then we will kind of tackle those near the end. So, all
Yay.
right,
Thanks,
perfect.
Susan, for having me. I'm happy to be here and talking about the business side of things. I think it can feel super overwhelming in terms of how to even share about this. I'm hopefully going to make it super simple for you. We don't need to know all the things about all the things. We just need to be able to share a little bit about the options, and then we're sending them over to the Clearshare Young Living website where they can look at all the FAQs, all the information's up there. They can set up a one-on-one with one of the benefits consultants over at Clearshare who will break things down, and they're great. If your plan that you currently are on is better, they're going to tell you that. They're not there to like hard sell you and pressure you into getting into this plan. So I'm going to share my screen and highlight how to share this as a business opportunity. This is weird. I don't know why. What is this whiteboard thing? Share screen. No. Oh, okay. Technical difficulties. Okay, so let me move this over. Zoom always like makes it so hard to get to where you need to go. Okay, so all right. So I'm going to share this as a presentation, which will not let me see any comments. So definitely just put any questions that you have into the comment section. I'm going to pretty much just kind of go through this fairly quickly just because I want to make this as concise as possible. So these health plans are an amazing opportunity that Young Living has given us to have another way to earn income. So it gives us another stream of income. Everybody needs some kind of health coverage, right? So this opens the door to people that don't care about Young Living products yet, right? Everyone's looking to save money, and open enrollment period is coming up. It's October, November, December. So this is the perfect time to kind of learn about it, start sharing about it. This is also going to give you a reliable, recurring income because with our Young Living products, as we all know, right, not everybody's ordering the same amount every single month. So our OGV is going up and down, loyalty orders are going up and down. It's not, obviously having people on loyalty is ideal, right? But that still doesn't guarantee how much income you can rely upon. Whereas this, once someone buys the health, enrolls on health plan, it's not likely that they're going to be quitting 1 month, adding another month, changing that, right? Once they're on a health plan, they're likely, hopefully, they're going to be happy and stay with this health plan for years and years to come. So that PV that we get from people being on this health plan is going to show up every single month, no fail. So it's great for individuals. It's also something that you can talk to small business owners. People that own a business with 49 or less employees are not required to give insurance to their employees. But as we all know, it's hard to keep great employees. So this is a way that you can give small business owners a perk for their employees. I'm going to explain that in a little bit. And you can also go and start talking to holistic practitioners in your area so they can increase their revenue. So this adds so much for everyone, but for holistic practitioners, it's going to give their patients healthcare savings. These people are already holistically inclined. Our holistic plan and the holistic savings plans are unlike anything out there at the moment. I've never seen a holistic plan this comprehensive. They get to choose their practitioner. They can see whoever they want, whenever they want. There are some health plans and health shares that do cover some acupuncture, some chiropractic, but it has to be related to a medical need. And then they only get a certain number of appointments. This one, you get the 12 or the 24. The holistic savings gives you 12 chiropractic or acupuncture visits per person per calendar year. The holistic one gives you 24. So you can see whoever you want. You don't have to see like only one a month. You can do all 24 visits in 1 month if you had that medical need. This is also going to give you a new income stream, but it can also give your holistic practitioner a new income stream. It's going to give you increased retention because those health plan people, that income is going to happen every single month, and an increase in your OGV. It's going to create greater OGV stability. So yes, we're going to start at 0 every single month, right? But when that PV loads up around the 25th of every month, that is going to be a stable way for you to know that you can keep your rank and your OGV. So for holistic patients, they're going to save money, and hopefully that will give them more money so that they can see those holistic practitioners more often. So we're going to take this little scenario. Each plan has a PV. I'm not going to go over those slides today unless we have time, but every plan has a different PV level, right? We get the PV loaded into our OGV, into the back office, virtual office, around the 25th of the month. So we're going to get fast start, but because fast start first month is 50%, but this is a little tricky. The fast start of this will start month 2 because the OGV of the health plan doesn't load up till month 2 of the person's sign up. So they're going to sign up maybe this month. They don't pay anything. There's no PV related to it. Nothing gets loaded. As soon as October 1st comes, then they start getting services. They get billed by Clearshare around the 6th to the 10th of the month. And the PV related to whatever health plan they signed up for will get loaded the 25th of the month. And then we get paid on that in month 3. So really, we're only getting paid month 2 and 3 on fast start. Then everything else is regular unilevel payment. But this scenario just gives you a highlight of the potential that we have here with this amazing thing that Young Living has given us. So we're going to take an example. This is not a realistic example because not every single person you're going to sign up is going to fit this. But just for math purposes, we're going to take someone that's 40 to 49 years old. They enroll in the holistic plus the Clearshare plan. That one's the one that has 24 acupuncture chiropractic visits, 5 naturopathic visits, 1 IV drip a month, 1 thermography per year. Okay. The PV related to that is 101 for this specific scenario. Okay. But because they're on the holistic plan, they also get that up to $75 Young Living supplement or oil reimbursement. So obviously, we're going to encourage them to put that on loyalty rewards, right? And ideally encourage them to get some consumable products, the supplements, so that they're having those products and they're going to use them month over month and keep it in their loyalty rewards. So if this person with the holistic plus the Clearshare plus their 75 PV of product is in your scenario, right? You're going to get 176 point value every single month from that one family that has signed up. You do that multiple times, you do that 57 times, you have the OGV of a silver, which, yeah, 57 is not a lot of people to have the OGV of silver showing up every single month, right? That's pretty fantastic. So you get paid basically sort of twice, okay? You're going to get paid on the health plan, and then you're going to get paid immediately that month that they're purchasing their Young Living products. You get paid for the products. And so this, again, just opens up a whole new level of people to our business, because people want to have savings on their health plan. They're going to get better services, $0 telemedicine, $0 virtual mental health, $0 generics, like all those wonderful things that the Clearshare plan has on top of all the holistic things. So anybody who's holistic, who's never heard of Young Living, because there's still a lot of people that have no clue what Young Living is or what they do, right? Even people that aren't super holistic, but maybe they go and get an IV drip once a month because they want to get some glutathione or whatever. Those people are now new warm market people. They can sign up for this health plan, get savings from their out-of-pocket costs, and then because if they're on the holistic plan, then it's our job to educate them about why our products make sense. Because if they're going to get $50 to $75 worth of product for free, why wouldn't you buy the products, right? So Ningxia Red covers is covered for that. All our supplements, all of our essential oils, which is insane. So thinking in terms of this, then you want to be able to go and start talking to those holistic wellness centers. Why wouldn't you want to have them offering healthcare savings? They already have people that are holistically inclined, right? So this is like a no-brainer. There's no network. The patients can choose whoever they want. There's no medical need limitations. The practitioners are going to have an increase in revenue, because the way that the holistic plans work is that any chiropractic or any acupuncture visit, the member is going to end up paying $35 for the visit, but they're going to get $175 reimbursed. They're going to pay the practitioner up front. So the practitioner gets all the money up front. They're not losing anything. There's no risk to them. They're going to get all the money up front. All they have to do is give the patient an invoice. And here's where it gets really cool. You want to go get a raindrop? Find a practitioner, a chiropractor or an acupuncturist who has someone that does raindrop in their office. If you get your chiropractic visit and the raindrop at the same visit, have them put it itemized on the invoice, you submit that to the holistic needs request form on your app. Within 30 days, you're going to get $175 if you've maxed out. So you want to find practitioners that have wellness centers that have multiple modalities or add-on services, so that you can have these appointments add up to 210 or more. 210 is basically the minimum that I would recommend, because why wouldn't you max it out if you're going to get $175 back, right? 175 plus 35, which is what your visit would cost, 210 total, paying $35 for your chiropractic and a raindrop or your facial or your massage or whatever you want to add on. So it allows the practitioners to increase their revenue by asking people to add on their services if they know that they're on this plan. because these days everyone's budget's super tight, right? And so adding on those services is something most people are not going to want to do because budgets are tight. But if they know that they're going to get $175 back within 30 days, why wouldn't they do that, right? And so I'm using chiropractic as the example. You can still add on to acupuncture, but acupuncture follow-up visits tend to be a little bit more pricey, so there's not that much wiggle room in terms of the add-ons. But even still, if you go over 210, maybe it's a $295 appointment because you've added on a couple different things, you still end up getting 175 back, and you ended up paying 295, you know, and the difference of that you end up paying. So it's a really, really fantastic thing to bring up to any holistic practitioner, even if they're the sole proprietor. They're just a chiropractor, there's no other services, maybe they only are an acupuncturist, they only have that one office, they don't have other people. Now they can start looking at, like, well, can you get a laser, a cold laser machine? Have the patient sit in your lobby with the cold laser while you're adjusting somebody else. What are the add-on services that can be done in office without a lot of monitoring, without someone having to like keep, you know, hands-on or sitting right there, that the patient can self-administer once they're set up? Maybe they do, you know, lymphatic drainage, those like compression things in their waiting room. This is going to give the practitioners another stream of income and give them more income by having those add-on services. So again, the practitioners still get paid up front. There's no risk to them. They're going to save money. The patients will save money, hopefully leading them to see the practitioner more often. Then let's talk about the businesses with less than 49 employees. They're not required to give health insurance to their employees, but here's a perk that the owner can offer to the employees. The owner would sign up as a brand partner, offer the health plan to their employees as a perk. The employee is the one paying for the health plan, and the owner's not paying for anything other than whatever they have to buy for to be commission eligible, right? But then this is giving employees a perk of being an employee of that business. It's going to give the owner another stream of income. And even if that person quits, as long as they're still paying for their health plan, that owner will still get the benefits of the commission. The owner can use this as an employee retention tool. So if you go back, I can go and show you the prices with the PV, but basically the cost of these health plans are not crazy high. I think like the most expensive one might be like a little over $1,000 for a family with the holistic plus the Clearshare in the oldest age bracket. So even if the owner was doing a reimbursement for 1 year, maybe they're giving 10% back. If you stay with the company for 2 years, maybe they're giving 20% back or whatever, right? They can just give a percentage of whatever their health plan is, reimburse the employee directly, and keep that employee happy because they're a great employee. You want to keep them. And so this just gives small business owners another way to keep their employees happy and to retain them if they're great employees and to earn another stream of income. So this whole slideshow is available in the Young Living Health Plan Facebook group. You can, if you have Canva Pro, you can go in here and add your contact info and have it ready to go. But that's the basics. Let me go back to the prices just so you can see. Oh, and now it's stuck. Okay, this is the holistic plan with the Clearshare. So this is the most comprehensive plan. It's the one that has the 24 acupuncture chiropractic visits plus the Clearshare, which is like the medical and emergency. And these are the monthly fees based on the different annual maxes, which work like deductibles. So there's a 1,000, a 2,500, and a $5,000 annual max. So the most expensive plan is the 1,000 annual max for someone that's 50 to 64 years old that has a family with kids. So again, with that reimbursement, the employee retention thing, if someone's giving 10% back to their employee for staying for a certain number of years, that's what, $12.80? Not a big deal per month to keep a great employee, right? This is the holistic savings plus the Clearshare. That's the one with the 12 acupuncture chiropractic visits. Here's just the holistic plan. The holistic plan, I just want to highlight, there's no annual max, no deductible. You can start using this immediately and start benefiting from those reimbursements. And if you have anyone who has pre-existing conditions, they can qualify for these holistic plans. There's no exclusions. And then here, so check out, the PV is lower for those. And then here's just the Clearshare plan, which is great for people who just want the medical and emergency coverage. And so, lots of people are on government assisted health care right now, but those programs really are awful. They don't give you a lot of benefits. The services are awful. The wait times are awful. With this, you can get somebody on the Clearshare plan. They're going to have $0 telemedicine, $0 virtual mental health services, $0 generics, and just a lot better benefits. No network, not having to, deal with going to a doctor's office, waiting there for hours, or an urgent care. They can use that telemedicine for all their medical needs, unless it's an emergency, right? But even with just the Clearshare plan, the PV of that is still pretty generous, and that's going to show up every single month. So I'm going to stop sharing. That is a really quick overview of the business part of it. But what questions do you all have? I see that there are some.
Yeah, there was one question just asking how much is the average chiropractic visit? She said she didn't understand the percentage back portion.
Yeah.
So
So when you go to the chiropractor, okay, I'll just speak from my own. My chiropractor, the first visit was $200. That was like a really comprehensive, like medical history, talking about all the things. She evaluated me, how many walk, measured, blah, blah, blah. That was $200. My follow-up visits are like $75 a visit. Depending on where you live, it might even be $35 a visit just for the chiropractor. But if on the holistic or the holistic savings plan, if you end up, we all end up paying $35 for our visit as part of the holistic plan. That's kind of like our copay. But we're also going to get $175 back. So some people are like, well, my chiro is only $35. Like, this plan doesn't make any sense. It does, it's not for me. Yes, it is. Because yes, you can go see your chiropractor for $35. You will end up paying her $35. You'll end up paying that and not get anything back. But now you can talk to your chiropractor about add-on services. What else do they have? Do they have laser? Do they have red light? Do they have compression? Do they have whatever? If there's a massage therapist or a raindrop therapist or even a facial esthetician person in that office, and you can get those add-on services at the same visit and on the same invoice, you will get up to $175 back for all of the things that you add on to that chiropractic visit. Acupuncture tends to be, at least here in San Diego, like a follow-up visit's $90, $95. So you don't have as much wiggle room as a chiropractic visit, which can sometimes be about $35, $75 for one follow-up visit. So with the holistic plan, there's no exclusions. If you get cancer, then you can still see all the holistic practitioners. If you have Clearshare, which is the medical and emergency plan, if you get on Clearshare and then you have a new diagnosis of cancer, that is part of the shareable thing. So you would pay your annual max, which would be the 1,000, the 2,500, the 5,000, and then anything over that would be shareable. They have something called care coordination, which is an amazing perk of the Clearshare plan, where if you have an x-ray, lab, MRI, or a surgery, or there are certain diagnoses that require that you go through Clearshare first. So if you were diagnosed with cancer, you would go contact the Clearshare department, give them some time to find practitioners in your area. If you use the practitioner they recommend, then your care for that is free and your annual max is waived. If you don't want to use whoever they recommend, you always have the choice to go see whoever you want, whenever you want. But for specific diagnoses like cancer and a couple other things, they want you to go through care coordination first because they're able to kind of see who in your area has the best pricing, the best care, and the best outcomes. And so they're going to point you in that direction. Hopefully that matches up to maybe who you want to also see. But if it ends up not being who you want to see, you can go and see whoever. But there are those couple of diagnoses that do require that you go through care coordination first. But yeah, for the holistic plan, you can have any kind of diagnosis. So there's a lot of people that get a cancer diagnosis and they want to just do all the holistic things, right? And that's a ton of money out of pocket. IV drips, chiropractor, acupuncture, naturopathy, all of that. And so they can save so much money on their out of pocket costs by just signing up for the holistic plan. You can just sign up for the holistic or the holistic savings plan. If you want to keep your own traditional health insurance or whatever health plan that you have, maybe your employer offers for free or your spouse's employer offers it for free, you can add on the holistic. Or what we're actually recommending is figure out how much, if your spouse or you get the insurance through your work, find out how much it would be for your partner and the kids to not be on that plan, because you're probably still paying out of pocket for you and the family to be on that traditional health insurance plan. So it might be a cost savings to have the partner and the kids on Clearshare plus whatever holistic plan if they want to be on a holistic plan. So if you're a naturopathic office with red light compression, yes. Is that covered? Yes. So with the holistic savings plan, you get 3 naturopathic visits. You get 5 with the holistic plan. And so you end up paying $20 for the visit and get $150 reimbursed. So it's not as generous as acupuncture and chiropractic, but it definitely still benefits people if they go see a naturopath. Or you can use those doctor visits for like a regular doctor. I'm going to go see my dermatologist. I don't want to have that go towards my annual max. Like, it doesn't make, I'm never going to meet my annual max unless I have an accident, because we're choosing the $5,000 annual max. So I'm going to see my dermatologist as one of my 5 doctor visits. I also go see a DO because she does osteopathic manipulations. So I've used her 1 time or 2 times to get those done. But I've specifically found chiropractors and acupuncturists who have wellness centers, who have other things, so that I can really max out that $175 visit reimbursement. So it's 3 doctor visits per year, per calendar year per person. The 12 or the 24 acupuncture chiropractic visits per person per calendar year as well. So I've signed up an acupuncture wellness center and a chiropractic wellness center. They're getting all the practitioners up to speed and signed up. We're going to do email blasts now that it's getting very close to open enrollment, and they're going to send out email blasts to all of their clients that have ever come in the history of their, practice. and let them know that these health plans are now available. So I think especially these days with costs rising with everything, here's one place we can help people save a ton of money. My example is we were paying $2,300 for a PPO at Blue Shield with a $7,000 deductible per person. We're never going to meet that. Never, right? We don't go see the doctor. You know, it was just for emergency purposes. And we thought that having a PPO was the safe thing so that when and if we had something, we could go and see whoever we wanted. But then we had a situation with our daughter and we couldn't go see the pediatrician that she's had for her whole entire life. And then Blue Shield sent us a letter saying, oh, by the way, your insurance is going to be increasing $500. So we would have been paying $2,800 a month for a plan that we never ever use. And it makes me so sick to think like we have been paying that for freaking years. And now we're paying $940 for Clearshare and the holistic plan. And believe you me, I am going to the chiropractor and the acupuncturist and the naturopath and all of that because I'm like, I'm getting all my money back. So definitely recommend doing that. I see that there's a question on how do you speak to a wellness center. The acupuncturist I knew, and she and I had just started talking, and then I told her, like, have you heard about the Young Living Health Plan? And she's like, what? Young Living has a health plan? She had been a member, I don't know, 11 years ago, thought she was going to do the business. It petered out. She was on my team years and years ago. But then once she heard about this, she was like, wait, tell me more. And so once I told her about the Healthshare, she thankfully was already knowledgeable about what health shares were and was looking. And she's like, I want to sign up for this right now. And then she had actually had a friend who was on Clearshare, not our Clearshare plan, but Clearshare has many other plans. And their child had to go to the hospital, and Clearshare was amazing. And she's like, I know that name from somewhere. And then the more she thought about it, she remembered that situation. So that's how I got that one. The chiropractor, I started to go see her because I looked for someone that had lots of extra services. And the first couple times I just mentioned to her, like, oh yeah, I get $175 back for every visit. And then she does massage too. So she's doing my chiro and then she's doing my massage. So while I'm laying on the massage table, I'm telling her, like, oh, by the way, did you know that there's this health plan that I keep mentioning that I get $175 back? And she's like, wait, what? And so then I was like, can we set up a time where I can sit down with you on a Zoom for like 30 minutes where I can just show you some slides and tell you about it? And once she saw the slideshow, which I just went through part of it, she was like, yeah, this makes so much sense. Like, why wouldn't I want to save my clientele money? Like she has a membership program where people pay like a monthly membership and then they get like a discount on their pricing. But she's like, this, in addition to the membership, gives them so much savings. So she's super excited about it. So yeah. So I'm, especially now that open enrollment is happening, I'm going to be talking to people and just bringing up health insurance. I've been going to some networking groups for entrepreneurs, and that's what I'm talking about. I'm leading with that, not with Young Living products. You know, I'm leading with, I help people. I have a Young Living wellness business. I help people save a ton of money on their healthcare coverage, especially if you prefer holistic services. That's it. And then they're like, and then I ask them, like, do you go see the chiropractor? Do you see the acupuncturist? Do you go to the naturopath? Do you get an IV drip? If they say yes to any of them, then I'm like, let's set up a time to talk because you need to know about this plan because I'm paying $940 and we're getting $700 back a month. And they're like, what? So it's definitely super easy to talk to people because everybody has to have health insurance or some form of health coverage, right? And so with open enrollment happening October, November, December, this is the perfect time to start polling people, maybe just even put a poll on your Facebook page, do you love your health insurance? Most people are not going to say, I love it. Like, are you happy with the price that you're paying for your health insurance? Most people are going to be like, no, no, thanks. And then just know that we've got the Young Living Health Plan Facebook group that we've created for everybody in Team Young Living. There are slides like Instagram and Facebook graphics that you can use, download them to your phone, share. There's trifold brochures, there's flyers that you can use. There's so much information on there. Jessica Petty has made some scripts, so check out the files for that. But there's a ton of information there for you to just grab, copy, paste, edit so it sounds like you. Share the slides on your socials and the goal is just to pique people's interest. Get them interested in like, what is that? What are you talking about? And then I have a faceless video of me going through all those slides. It's 37 minutes long. You can ask them, would you prefer a video or would you prefer to look at some slides? Both of those are available in the Young Living Facebook group. And then hopefully they pick one or the other. You send them the slides or the video, and then you set up another follow-up appointment, call, text, whatever, so that you can follow up with them to answer any questions. And then if they want more information, great. Send them over to the Clearshare plan site to set up the one-on-ones. There's free 30-minute one-on-ones with a benefits consultant that will help people figure out what plan would be best. And if you have people that are on Medicare, they are still eligible for the holistic or the holistic savings plan. And Clearwater, which is like the parent company of all of this, just recently got approved to help people with their Medicare plans. So if they're on Medicare, you can send them to the benefits consultant. They might even be able to save some money on whatever they're paying for their Medicare as well. So you're sending people over there for specifics about the health plan. You're also sending people to the main website to get a quote. Like we're not selling health insurance or health plans. Like we don't want to call this health insurance because it's not, it's a health plan, but we're not selling anything. We're sharing about it, piquing people's interest, and then sending them over to Clearshare. And if you have practitioners that are interested in learning about it, the video that I have, or even the slides that I just went through, will hopefully explain enough to them about why this would be beneficial that then you can say like, okay, well, create your free Young Living account. And then, let's figure out how you want to start sharing about this with your patients or your, email list or your employees, that kind of thing. So any other questions?
I think that was it. I think we got them all. So yeah. Okay, so I put in the chat here, there was a previous video that Carol is referencing here. So the link is in the comments here. That video is very good. It's the one that she said is 37 minutes. So my plan is truly right to do what Carol said. It's kind of what we've done all along, but for whatever reason, this feels scary, right? It feels like, So, but we want to create people's interest. We want to create some curiosity, and we do that by asking questions. So I think if your space is social media, asking some of those questions, seeing what people comment, and then reaching out to those people. Something that I just was thinking too is, since it is open enrollment, why not offer, a gathering in an evening, and you can play the the video that Carol did, and and just serve coffee and dessert, and just be like, no harm, no foul. Come and listen to this if you are, open to looking at, maybe a more affordable option for your healthcare. And so I think it's just kind of stepping into that space, right? To know we don't have to know all of the questions, even though Carol, she knows all the answers. She's very good. But but you don't, right? It's just getting them to that place and then getting them connected with a one-on-one consultation. So yeah, and there are a ton of resources in that Facebook page. In fact, I should probably grab that link and then put it here. But yeah, so if anybody else has other questions, drop them there. But I think we're going to end up getting this call wrapped up. Here is the link to the Facebook page in case somebody is on and they are not in there. But yes, so I know there was some questions early on just about how does this help with your business? You could see on that one slide, right? You just enroll a few people in this program and that is OGV. That will just be reoccurring for, for you to keep and ranking up, right? And so it's just beneficial all the way around. So, all right. Do you have anything else to add before we say goodbye?
I don't think so.
Okay. All right, you guys, thanks for joining us live. And I will get this uploaded and recorded, and we will put it in the spots where you grabbed this recording link. You'll find it. So thanks a lot for joining us. Have a good evening.